A lot of people have a tendency to say, well, I don't really understand insurance. I never have understood insurance. You've explained it to me, but I still don't get it. But I do know that this plan over here, the Medicare Advantage, is very inexpensive, and the Medicare supplement that you're proposing is around $100 a month, somewhere in that ballpark, versus I've got these advertisements in the mail from several different Advantage companies, and some of them say that I may qualify for no monthly premium at all. So I don't understand either program. I think I'll go with the one that doesn't cost anything. It can turn out to be a really bad decision. Your responsibility if you get sick, if you get injured, if you seek medical care, if you have Medicare and a good Medicare supplement, your responsibility is going to be $198. You're going to have your monthly premium that's going to be due every month. But then if the bad thing happens and you end up with medical care and hospitalizations, etc., what's your responsibility going to be? What are you going to have to dig in your pocket for? $198. A very, very low deductible, minimal amount of money that you're going to have responsibility for if the bad thing happens. And why would you buy insurance in the first place? But to protect you financially in case that bad thing happens. Now, on the Medicare Advantage side, very low and sometimes zero monthly premiums. But if you get sick or injured and you need medical care, each encounter with medical care is going to have some type of copay or co-insurance. You're going to have deductibles, you're going to have copays, you're going to have co-insurance. If a significant medical event were to take place, you're going to be out of pocket $7,000. And again, that's assuming that all the providers that care for you are part of the network, because out-of-network charges do not go toward that annual out-of-pocket maximum. Budgeting is key here. And when you have the Medicare supplement along with traditional Medicare, then you know your out-of-pocket costs for the year are almost certainly going to be no more than $198 out of pocket. So you can budget that. You can say, well, I'll just set aside an extra $20 each month in case something goes south this year. I can pay my $100 each month to the insurance company, and I'll set aside $20 each month. But I don't know what you're going to do. I don't know how you're going to handle it. If you have a Medicare Advantage plan, and between the plan's out-of-pocket maximum and the providers that are out of network, if you end up with a bill over your head of $10,000, $20,000, it could be more. How are you going to budget that? How are you going to work it out? I think when you look at what the possibilities are and the fact that you ain't getting any younger, you need to get the best possible program that is quite reasonably priced.